College. He's a cornea fellow from LB Prasad Eye Institute and MCH Ophthalmology from University of Seychelles. He's CEO and head cataract and refractive surgery services and keratoconus in Sun Eye Hospital, Lucknow. And he's going to be showing us through 4 cases, techniques of phaco chopping, toric marking, comparison between manual and digital methods, chronic uveitis management with the iris hook, and intermittent cataract.
Thank you everyone, and good evening. And first of all, I must convey thanks to AIOS Chairman, Secretary Dr. Namrata Sharma and Dr. Sinha for having me here and giving this opportunity. It's a great opportunity because this is one of the prestigious AIOS Surgeon Hair series, and I'm really very feeling honored to be a part of this Surgeon Hair session. And today we'll try to showcase a couple of cases, few of complicated cases and few normal cases where I'll show the technique of phaco chopping and other techniques and the phaco, and simultaneously we'll implant toric implant where we'll match the manual marking system and the digital system, because most of the time the freshers, they think that they need the higher end equipment to start the toric implant. So it is not so. We can start it with the normal manual systems also with the basic equipments. So thanks again the AIOS. Thank you Dr. Namrata, Dr. Sinha and the whole GNJ team. They really did a lot of efforts to make it possible to be live from our theater. And
we would also like to thank you. We would also like to thank you for letting us peep into your operation theater and to give us the opportunity to see the wonderful cases that you're going to do. Wonderful case selection, and I'm pretty sure that everyone will really get to see a very nice, not only surgery, but wonderful message from the surgery.
Thank you, Dr. Sinha. And I have 2 of my colleagues, Dr. Smriti Mishra and Dr. Saurabh Gangwar. They are both consultant at Sanai, and they'll be also with me just to, because Dr. Smriti has vast experience on retina. She is head of video retinal services here, and Dr. Saurabh is in medical retina. He is also doing a lot of cataracts and refractive surgeries here. So they will be also with me along with during the session.
Welcome, Dr. Smriti and Dr. Saurabh.
So shall we start?
Yes.
Yeah. Can we have the details of the first case?
Dr. Saurabh. So, Dr. Sinha, this is a female patient. I am going to operate the right eye, and this is a normal case with the slight, corneal opacities, especially the arcus is more prominent. Otherwise, the cataract grade is hardly grade 3 or grade 4. And here I'll try to demonstrate the chopping techniques, and we'll implant the IHANS implant. So later, during the implant, I'll tell about the implant. If you have any questions in between, then definitely I'll try to answer. So just to start with, usually I may start with 2 side port incisions, one for my rhexis and one for my second hand instrument, and a clear corneal incision 2.2 millimeter for my phaco surgery. How is the microscope view?
Yeah, it's good.
It's very good. Very good.
Hello everybody, good evening. I am Dr. Saurabh Gangwar, and I shall be narrating the surgeries performed by Dr. Sudhir here.
Good evening.
Good evening, Saurabh.
Now usually sir makes the two side port incisions. Now this is capsular axis. He is using the 60 tome.
You can see that corneal opacity, the glow is not so good.
Yeah, we can see that.
I'm trying to achieve a good size capsular axis around 5.5 millimeter, and the surgery is, the axis is done now.
Now the main incision.
Clear corneal 2.2 incision. Normally I don't catch the conjunctiva because whenever you are doing the topical surgery, it is always, not wise to hurt the conjunctiva. So I always take the help of side port incision to stabilize the globe. Now before going for hydro procedures, it is recommended to wash out the amount of viscoelastic so that you can release the pressure.
You can see the golden ring.
Yes.
Yes.
And today I am using a Signature Pro machine, and the viewing system is from the Zeiss.
What
So whenever I
parameters
am
you will be
out of
using in
center,
this?
I normally use a Sinsky hook. I don't use choppers, especially the big size chopper. This is again a Sinsky, which has slightly more larger flange. I just held the nucleus and
Sir usually perform the direct chopping technique of the nucleus fragmentation.
Yeah.
After chopping, the mode is changed to quadrant.
So you never use any chopper even in a very hard cataract or?
no. I think the trick here is of vertical chopping is the, in fact, this is not a chopping. I always say that it is a kind of crack.
Crack.
The trick here is just
Separation.
hold it properly with the vacuum, and then you can play. I'll try to demonstrate in my next cases also, because here I couldn't demonstrate actual vertical chop. So now a peninsular plate is there. You can very easily
So do you change the mode while
yes.
taking out the nucleus?
Now I am in epinuclear plate removal mode where the vacuum is less,
Yeah.
and because there is no need for power, so very low power. Micros you can see the stability.
Absolutely. Very nice, very smooth and very quick.
Lens low karo.
Now since the cataract was very soft, so sir is saying he will be demonstrating the proper chopping, or as he says, crack technique in the next few cases.
So what machine was being used? Sorry, I was.
Pardon, ma'am?
What machine were you using, Dr.
So
Sudhir?
this time we have a Signature Pro.
The
Parameters you can.
IF probe, you still like to use a coaxial one? Like a,
Yes, I still use coaxial because we are from the era of coaxial.
and
I tried bimanual also, but for the bimanual we have to, enlarge the side port incidence.
uh,
So still I am more comfortable with the, you can see that the corneal opacity
Yeah, there is
Cornea
a
is not
fungal
Yeah.
place which is present.
Now this is hydrojet polishing. Just place a cannula parallel to the posterior capsule, and you can flush. You can remove the fibers, and even the fluid can go towards the equator.
Yeah, sometimes there are small fiber
Yes.
cells that adherent to the capsule, so it's a good
Yes.
idea to use this jet to separate them.
Now in retroillumination, you can see that opacity.
Yes, it is visible. It is visible.
So here I am going to implant IHANS because still the patient has corneal opacity, but this is a kind of monofocal which gives good intermediate vision. So obviously the multifocal is not a choice of implant in case of the patient has any corneal opacity or any kind of problems.
Yeah.
But this is the lens which is always supports us.
That way it is a more friendly lens and more
Exactly.
at least there are no side effects. And with good vision, good intermediate vision and distance.
Because I always implant the IOL under high viscosity, under Helon or
Mhm.
any parallel, any equal to Helon, and so it is necessary to remove the whole of the visco.
Yeah, but it will be easy to remove as well because it will take less.
Yes, it comes as in a bolus.
Yeah.
That was very smooth, Dr. Sudhir, despite the fact that there was some amount of corneal haze present.
Yeah.
Hydro.
Very smooth and clean surgery, Dr. Sudhir. Wonderful. Wonderful demonstration.
Thank you.
And very quick. Let's say that.
There is a thesis priya that we can see there, and that means that is one sign that the entire viscoelastic is out, and that is why you have this.
So you can see the one line here.
Yes.
You can see the line on the posterior capsule.
Fold. Yes.
That fold is indicates that there is no viscoelastic behind the IOL.
And the IOL is in the back.
Yes.
It is a perfect, demonstration, and we see it very well. Your microscope is excellent.
Thank you, ma'am.
So you